I was training. I went to a mandatory function, a softball game, was running around the bases, slid into second base. A shortstop came and ran and stepped on my ankle and popped all the ligaments off my ankle. And so my future was going to be, 2 surgeries, in a wheelchair for about 4 months. It was pretty bad. And so I remember laying on the couch alone, dizzy. I was in a horrible place mentally. And I remember calling up my mom. But I told my mom, I was like, I don't want to live anymore. If this is how the rest of my life's going to be, I just can't handle it. And, at that point in time, I recognized that the one thing that you can never escape is your own mind. And I was noticing every time I was with patients, they were battling something that was unseen. And so they were suffering, but it was unseen suffering, where it's just them. And that's difficult to go through when you have pain and no one else can relate to it.
Time to embrace change and be about that life. Good morning. This is Dr. Bass with the About That Life podcast, the podcast that focuses on life, on living intentionally forever. All right, it's almost summertime, and we really want to get back out there, get back to doing things that we enjoy. So we are at the gym, or a gym, a wonderful gym, where they're allowing us to just have an opportunity to speak with one of my friends, one of my colleagues, about an issue that affects all Americans, many Americans, and unfortunately, this isn't something that people commonly talk about. We're going to be talking about mental health today. Now, I know you're wondering, Dr. Batts, why are you at a gym talking about mental health? Because we know that health, fitness, wellness, and various things like that are ways to improve our health in such a way that will allow us to have some resiliency with respect to that. Now, I wouldn't go into this as a cardiologist thinking that I know everything about mental health. I know that it increases your cardiovascular risk 3 or 4-fold. I know that once an individual has a mental health issue, that those problems can reoccur throughout life. I know that in patients with heart attack, heart failure, stroke, mental health issues are one of the biggest issues for morbidity. So with all those things, as a cardiologist, we have to embrace the fact that mental health is here, real, and affecting our patients. Well, I didn't want to take on this task by myself, so I enlisted the help of a friend of mine. As you can see, he's a bodybuilder, right? So this is Dr. Kenneth Johnson.
How's it going?
Who is here with me today to talk a little bit about mental health. But you all have heard enough from me. I want to talk to him. So Dr. Johnson,
whatever, we go way back.
We do go way back. All right, Kenny.
Yeah, it's cool.
Well, let us know. So first off, what's your story?
I do want to say again, thank you to Mount Olympus Gym for allowing us to be here. This is the spot, where I get my mental health, my iron therapy in. Iron therapy, yes. And so essentially, I've been into fitness my whole life. And so, back when I was in high school, I would say, or even middle school, I played soccer. That was my sport of choice. My cardio fitness. I know that's what I was going to say. I know I'm a long way from that.
Must break the balls when you kick the
Well, wait till I hit you with this one. So, I transitioned into breakdancing, and breakdancing was my form of, first time he's hearing these. So I transitioned to breakdancing, and that was my form of movement, the way I kind of expressed myself. And so I transitioned, did some things, and then went into the military, joined in 2005. It's been a while,
Mm-hmm.
And that's when I actually started lifting more weights. I got with 2 individuals, and they were big, massive guys. I mean, benching 315, which is a lot of weight. And I was like, man, I want a little piece of that too. And so they took me under their wing and, made me just rack their weights. I was the person taking them off and on. I was a workhorse. I got to show you a picture of how I looked when I graduated basic. I was pretty frail. But that's how I started in the gym, really lifting. So the military kind of got me into the weight room. But from there on, I just stayed consistent. And I always found mentors and people that, kind of were doing something or were somewhere that I wanted to be. And then, I just followed their footsteps, and
wow.
The magazines, all that stuff, eat a lot, lift a lot. And do a little bit of cardio.
Well, I don't have a problem with job security. You gonna definitely keep on.
I'm horrible.
While we were waiting to come on, he explained his addiction. We're gonna talk about addictive behavior. His addiction to bacon, right? To bacon. See what I'm saying? So
bacon, I love it. Yes.
So
I got you.
So you got into weights, you started lifting, and it opened up a whole new world.
A whole new world. Yeah.
When I talk to my patients, whether they're young or old, and they start to do weight training, it allows a certain level of focus, a certain level of commitment, as well as accountability. Talk about that for you and how that allowed you to transit. Now, I didn't give you your kudos. I'm just not talking to a bodybuilder and a weightlifter. Tell them what you do. Just get that out. They know.
So I understand. Yeah. So I kind of spoke on it before. I'm in the military, and so within the military, I was able to transition to become a doctor. And my chosen profession is psychiatry, and so that's what I do. I thank the Lord, that I made it this far. And so I help people with their mental health. That's what I do for a living.
Now and I know that in cardiology, it's tough. It's not a lot of cardiologists that look like you and me.
No.
Okay, you know where I'm going with this. And in the mental health space, I think it's equally as bad, if not worse. So, what made you consider mental health as a profession in the medical field?
So this is a deep question. So, and I don't think I've ever talked about this on a public forum before, to be honest with you.
Okay.
And so when I was training back when my heart worked a lot better, I was planning on getting out of the military. And I had went through some relationship issues. Divorce actually is interesting because it's similar to the story that you had the other gentleman on, your pastor bodybuilder. But I was just, wanting to get out of the military, do something else. So I got this letter in the mail saying, hey, we want you to come to a soccer combine in Florida. So because I play soccer, I had a little skill. So I was in Ohio, and I trained all through the winter by myself with a couple people sometimes, really train and try to get my skills up. And this was at a time when Major League Soccer wasn't big. And so people who I guess were like, I don't want to say scrubs, but like C, B athletes had a chance of making it to the league versus now, it's on par with like, the English Premier League. But so that was my goal. I was like, I'm going to get out and play soccer. And so what happened is I was training. I went to a mandatory function, softball game, and I didn't want to play, but I was like, okay. I had a week left in the military. Was running around the bases, slid into second base. A shortstop came and ran and stepped on my ankle and popped all the ligaments off my ankle. I believe it's called the delta ligament. And so I had never been injured like this before. And so for an athlete injured, that's huge. And so my future was going to be, 2 surgeries, in a wheelchair for about 4 months. It was pretty bad. And so I remember laying on the couch alone, dizzy. I was in a horrible place. It was in a weird place mentally. And I remember calling up my mom. And, I guess some people could say I could be kind of dramatic. But I told my mom, I was like, I don't want to live anymore. If this is how the rest of my life's going to be, I just can't handle it. And, at that point in time, I recognized that the one thing that you can never escape is your own mind. You can't. You're always together. There's nothing you could do. You can't take a break. And I'm known as Mr. Positivity.
Right.
I can't think of many days that I'm not positive. And so that was a weird space for me. And I never forgot that. And so moving forward, I said I wanted to help people. And I knew I wanted to be a doctor. Initially, I was like, I'm going to be an orthopedic surgeon to help people with their ligaments. I'm going to do this. But as I transitioned, or as I was going through the hospital, and I was noticing every time I was with patients, they were battling something that was unseen. And so they were suffering, but it was unseen suffering, where it's just them. And that's difficult to go through when you have pain and no one else can relate to it. And so it really spoke to me. And I just said, being a surgeon sounded cool. I was like, yeah, I'm going to be a surgeon. But mental health, psychiatry just really stuck with me. And so
pulled you in.
It almost like I couldn't get away from it. And so I did something that a lot of medical students don't do. I did extra rotations in psychiatry just to see that I didn't want to do it, because I was like, man, there's no way. Psychiatry doesn't sound sexy. It doesn't like cardiology. I work on someone's heart. It doesn't sound like that.
Even though it is cool, by the way.
It is cool.
Anyone thinking about a profession, just know cardiology is a great way. So
growing up, I was just gonna say the mental guy, the mental doc, is the nerdy guy.
Yeah.
The bow tie, sitting in the office.
Tradition. You get on the the couch.
Get on the couch,
and he talks about Freudian approaches and what was your underlying childhood, and
I am telling you.
Tell me more.
Exactly.
Open-ended questions.
No,
that ain't cardiology. Is yes or no. It is binary.
Yes. Yes.
45 minutes and you unpacking when you didn't get something for. But I know it's more than that.
It is. Yeah.
So coming through that place for you, and saying to yourself, man, I can't escape my mind. I can't escape what it's doing. And then when you saw those patients that were battling that, and I see it all the time in the hospital, and we try to provide some solace, but it's tough because, and I'll say me, I won't speak for all providers, but we are ill-equipped. I can remember back to my behavioral health rotation in medical school, and it was one block. And you learned about depression, maybe you learned anxiety, but we learned it from the biochemical perspective.
Yes.
We didn't learn it from the trauma perspective.
Yes.
We learned it from the, where those synapses in the brain don't do what you want them to do.
Yes.
And so as you started to see it, how did you develop a way that is personable and takes it out of that scientific, clinical, pure, which I know you can't do that completely, but how did that?
Yeah, I guess what I like to remember is that, and this is something that I got from you actually as a student. This was my mentor when I was a student. Is just connect with people. The first thing is connection. The second thing is to let people know that you care. Connecting and letting them know that you care is probably 90% of the battle. And then it's just allowing people to understand that they're actually in control of this process. I'm more of I call it the consigliere. I'm here to let them know about the options. This is the safe things. These are the unsafe things to do. But at the end of the day, they're the one that's behind the wheel. And so, yes, I might seem like I'm the one with all the knowledge and the jacket and yada, yada, yada. But I'm just here to let you know that I care. We've all been through something as humans and people, so I want to connect and let you know that I'm here to help you solve your problem. I'm not here to solve. I'm here to help you solve. And that really helps. Yeah.
No, and it's that relational nature of first connecting, right? Second, caring, and then third, providing counsel. And that's what
counsel,
right? And that was and you said it.
Yeah,
and that's how I approach. And when you look at that, that's not specific to medicine. Right? That can transcend pretty much anything.
Yeah.
Whether you're meeting someone for the first time, whether you're trying to build a relationship, whether you're looking at how to improve your relationship or issues in relationship, it's going to be in one of those spaces. So now we take psychiatry and we make those connections. We show patients we care. You provide that counsel. But psychiatry, just like cardiology, has some disparities.
Yes.
And especially in our community, there was an article that came out that talked about African Americans are in a cardiology desert. We talk about food deserts and those type of things. And per square area outside of the Atlantas, the Miamis, the Baltimores, and Chicago, African Americans, and not to say you have to see an African American, but sometimes understanding where they come from and what the past is something that allows you to connect better.
Yes, 100%.
See that in psychiatry, and what challenges do you see moving forward? Because I think I know the answer, but I want to speak to it.
It's so many challenges, and give me anxiety just thinking about it. The issue is kind of what you alluded to when you talked about. There's the chemical piece, and then there's the other side to it. So we have something, not to sound too geeky, but we call it the biopsychosocial model.
Okay.
And so the bio is easy, you know, all the chemicals and stuff. That's what we do. We're human scientists. That's what we do. But the psycho and the social part is the part where in these minority communities is really difficult, because the psycho is how we think. And that's something that's developed over time.
Mm-hmm.
The social is that environment. It's like the soil that the seed grows in. And so you take an individual, you put them in this soil that can be not the best, maybe sort of toxic, some people would say. And then you develop their thought process over time in this soil. And then by the time they get to our age,
Mm-hmm.
they don't know what's wrong. And we try to help them uncover that and work through that. But that's a lot of pain to work through.
An example, because I think
Yeah.
I see it in the way we understand it in military is specific.
Yeah.
Give an example so folks can kind of understand that biopsychosocial model.
Yeah, sure. So essentially the bio is the piece that I give you a medication for. And so you have chemicals that are constantly going in your brain up and down. And so one of the things that we focused on in the relative present, I should say, is serotonin and dopamine. I can increase these, decrease these to make you feel a little bit better or worse, the feeling of being better. So that's important, the feeling, but I can't change the thoughts. And so the thoughts is what you go through therapy for. And this is the key. This is something that I wish a lot of Black males really took to heart, is that you feel like you don't want to talk to anybody. but you know, and yeah, something that I definitely understand. And the thing is that therapy works on the thought process to change the way you thought. It reinforces your behavior, reinforces the feelings. And so that's a huge piece.
Now, how do these thoughts come about, though? I mean, because why don't African-American males or males or people in general just have positive thoughts? I mean, does it go back to that soil or that environment?
100%. And so you grow up in a a culture that maybe is not as open about speaking about things, and so things become repressed. Even something as small as being angry. Why as a young man am I angry? Angry at society, angry at my school, just angry in general. And then not being able to get that out creates a trauma response. And people, this is something that we're just now touching on, but it's something that we like to call complex PTSD, I think is what the phrase is that we're complex PTSD. And there's no, and let me be clear, there's no, our psychiatry Bible is called the DSM. There's no DSM diagnosis for complex PTSD.
Right.
But what I'm saying is that when you have these traumas over time, again, going back to the soil, being angry, can't release it, maybe, I hate to touch on this, but, when the media or when your environment constantly projects, this cop is bad. I see this cop do this. I'm in a neighborhood where this cop is constantly pulling me over or constantly antagonizing me, just things like that. You start to think that everybody is like this. Generalize. And then, this happened to me just the other day. You get pulled over by the cop for speeding. Why is my heart racing? Why are my palms sweaty? Why am I shaking? The cop works for us. He's supposed to patrol, make sure. And I was speeding. It's normal. But why am I having a response like I'm coming back deployed, shaking, having flashbacks? And so the thing is when you multiply those experiences over time, they pop up every now and again. And you have to be in a space where you can talk about it. Luckily for me, I have great people around me where I can talk to, but sometimes you need a professional. A lot of times you need a professional to walk you through that process, to help you change the thoughts and change the behaviors. I know I gave a long answer, but that's essentially what therapy is.
That was beautiful because on another show, the What's Your Revolution podcast that I'm on as well, they had a guest on, Wayne Dawson.
Mm.
And what he talked about was the difference between a therapist and a coach.
Okay.
Which was cool because he talked about a therapist doing exactly what you said, unpacking that trauma and fixing dysfunction, whereas a coach really looks at your blind spots and helps
That's
you to
good.
round out who you are.
That's good.
And that's why I like your
That's
approach,
good. That's good.
right? Where I can fix this, I can give you a medicine to kind of get you through, but then I want to help you with therapy to kind of pull you along the rest of your way without that dependence upon me. Once you get to that safe place, now let's coach and say, how do you build that resiliency so that when you do run into that cop, even though you've had the therapy, you're on the medicine, you know how to back down. You know how to use these other behaviors to say, okay, this situation is X, this situation is Y, and my response should be commensurate, should be appropriate to that.
Yes. Let me tell you, just since we touched on it, I know we're going here, but when I was pulled over, let me tell you what I had to do is I had to say I was speeding. I had to identify the truth in the situation, the reality. Very important. Then I had to say the cop is not a threat. Now, could the cop have been a threat? Maybe. But I had to speak truth to what I know is most likely true. The cop is not a threat. I was speeding. This is a part of a normal process. That's also key. We all feel anxious at times. We all feel overwhelmed, but sometimes it's just part of a normal process. Like the gym. You're going to get your butt kicked in here, but it's part of the process. So I had to say different things to myself to change that psycho, the cognitive piece of it. I also, I hate to say it, but I had to go into my breathing. I had to slow my breathing. I had to slow my heart rate because I was feeling anxious, and I know that you can control the feeling of anxiety if you can lower your heart rate. So it's not a question of if it works. It works. You just have to buy into it.
Right.
And so I did those two things. And then I recognized I'm in Stone Oak, San Antonio. What is my environment? I'm not back in Houston. I'm not back in Houston anymore. I mean, I'm probably one of the only, one of the few melanated individuals that's passing through this place. But it's like, hey, I'm in Stone Oak. So I just had to do this for myself. And in the moment, my wife's next to me. She's not aware of any of this, but I know that because of past experiences, if I don't do those little things, then it can be bad for the rest of the day.
Right.
It can be bad then, but it can be bad for the rest of the day. And I don't want, remember, you can't escape this.
You can't escape your brain. I like that.
And
you can't escape your brain.
And I don't want it. I don't want that moment to have power over me for the rest of the day.
Wow.
That is the thing, is the communities that we grow up in, or, just underserved communities, these small micro moments are having power and control over them through the rest of their life. And so we need to find a way to release that. And that's what I do. That's what I do, yeah.
That's powerful. Yeah, it made me think about when I was pulled over. My family and I, we were doing these parade of homes that my wife has me driving on over who knows where. And we were on this country road, and sure enough, and even when I see a police officer, I get, and I hate to say, I have friends that are police officers,
No, yeah, my brother's a police officer.
And so it drives past, and I'm just thinking, and I was speeding.
Yeah.
I wasn't like you ran.
It normally is the case.
I was speeding.
It normally is the case.
And he gets behind me, stops, and my kids are in the back, and I'm like, oh man. And literally, like, I'm sure, and I didn't want to show them this, but I'm like breathing, and then I knew, all right, hands on the wheel, wallet out, license and registration, boom, I'm good. I roll the window down, refer to him as sir, and I think he was taken aback by how just
you'd be surprised. Like, you'd be surprised.
Oh, you don't understand.
Yeah,
kind of not.
Yeah,
and again, I had to say I was speeding. That's the truth. Is he a threat? He's super nice, super nice. Look, and ultimately he said, hey, slow down a little bit. I understand. Get out of here, right?
Yeah.
And again, and I'm not to say that that's everyone's experience. I know that kind of urban PTSD where youth and families grow up with the fear of law enforcement, with the fear of that environment is real. And unfortunately, it occurs far more frequently than we like.
Yes.
So I'm not discounting that, but I like how you said the vast majority of these individuals, like you said, they work for us, and they really want to help our society and our communities be better.
Yeah.
Now, you commented on something that I know you have a particular interest in, and that's that anxiety response.
Yes.
So now, talk about that piece, and then we're going to talk about strategy.
Okay.
So
Yeah.
Talk about that piece, that anxiety. So what is, I guess, clinical anxiety, and how do you know, or how are you concerned if you have it?
Yeah. So anxiety is one of the things in psychiatry that is actually kind of vague, to be honest with you. So it doesn't take much to have a diagnosis of generalized anxiety disorder. The key function, and this is the key function in anything in mental health, is there dysfunction? It's what you had said before, uncovering the dysfunction. So some people, strangely enough, can be anxious and they don't consider it dysfunction. They consider it a part of their superpower. Some say, hey, teach their own. But if you don't consider it dysfunctional, if you don't consider it a problem, then actually by default I don't, which is very interesting. But the idea is this concept of always worrying about things. And what I tell people is, when you have a good day, you go to the movies, you with your boo, you have some popcorn, the kids behave, or you hit a new PR, whatever it is that you have a good day. Yeah. Are you still worried? That's not normal. It's not normal. Yeah, and so that's a trigger. As I tell people, if that's your perception of your life when things are going well, by your standards, you're still anxious, then that's a problem. So that's generalized anxiety. There's also some physical things that come about, feeling on edge, tense. You can't sleep, and so that's another thing is you notice you have problems going to sleep because your mind is constantly. I use a phrase because it's so triggering as a psychiatrist. Racing thoughts. Everybody says this race.
Right.
Don't get me started. But your mind is constantly going. Don't do it.
I don't do it around.
No, I know. But to a psychiatrist, I'm like,
no, I'm nervous right now.
No. I say
about you making me think I had it. Diagnosing you with nothing on.
No, absolutely not. The reason I say that is racing thoughts. People assume that they're manic, that they have bipolar disorder. So I said, no, calm down first. Let's work through it. But with that anxiety, it's constant. It's just this constant worry. That is generalized anxiety. We also have subsets, which like social anxiety. So that's one thing. Right. The anxiety that you can't leave your home is a type of anxiety. And then associated with those are panic disorders. And so it's different. Panic disorder is something that I'm almost 100% positive they call you before they call me because the person feels like they're dying.
Right.
Now imagine how powerful your brain is where they feel like they're dying. And not only do they feel, but their body says, you are dying. Your heart is racing.
Goes up, blood pressure goes up.
Don't call me, call him.
Be careful calling me for that because I don't have because the thing is, people have come to like my candidness because I say, as a cardiologist, my job most of the time is to tell them it's not heart. It's not your heart.
I see.
There's tons of other things in the chest that can give you discomfort, and there's many more things outside of the body that can create that same feeling of discomfort, that same issue that you have that can be a problem for you.
Yes.
And I think once I allay their concerns, and whether it's a echocardiogram or an EKG or a stress test or a cardiac CT scan or an MRI in the context of COVID, to say nothing's wrong with your heart.
Yes. Yeah.
But let's unpack what's really going on.
Yes.
And that's where reaching out to individuals such as yourself, the primary care doctor and other things can really impact. But until you can say they've done everything they can for my heart, it's hard to move forward.
It's hard. It is hard.
Panic is one of those ones that are at the end of the list, right? Because they have to make sure that everything else, that we like to say a diagnosis of exclusion.
Yes, 100%.
The other health issues are gone. And then we'll say it's your brain, which, if I really think about it, it's probably the brain.
Most likely, yes. Most likely, yes.
We got most likely he's first. So
yes.
I love that discussion on anxiety, and hopefully it'll help people through that. Now, when we talked about that PTSD response, and you have to first identify the truth, determine threat, not threat, and then ultimately say, okay, how do I? Now, what are some strategies to reduce anxiety? You talked
Yes.
about the breathing component. Any other strategies that?
So the first step is to prevent the problem from starting in the first place.
I like that.
I mean, it sounds funny, but anxiety is one of those things that actually goes up and down.
Okay.
And so when you're feeling anxious or when you have a panic attack, it's going to go away eventually. Anxiety does not it does not stay redlined forever.
Okay.
And there's some reasons for that. I don't want to get so egg-heggy that, I go beyond when I need to, but we might have time at future episodes. But it goes up and down. And so you can get in front of your anxiety. When you're having an anxious episode, you can go through some things. Again, like I say, breathing is one of the things. There's something called grounding, where you put your feet in the grass, or just the idea of putting your hand maybe on your leg and saying, what do I feel? I feel my leg. I feel skin. I feel something to kind of take your attention away from your thoughts. Okay. Because again, your thought is the primary driver of what's going on here. Your thoughts are preoccupied with a future outcome that you believe is going to be negative. And the funny part about this, and I got this, I think, from, I think his name is Myron Golden, not a psychiatrist, but he mentioned that no one has a crystal ball. And I thought this was very interesting. Mm-hmm. Nobody has a crystal ball. So anything that you think about in the future is an imagined event. Isn't that interesting? Say that again. Yeah. So anything that you think about in the future, anything that you're forecasting is an imagined event. It's not real. And so why are we imagining the negative and not the positive? So that's something that's kind of hard to grasp when you're saying to yourself, I feel worried that my kid's going to get a car accident. I feel worried that the bill's not going to get paid. I feel worried that, and it's like you constantly do these things and you're forecasting these events, but it's in your imagination. Now, you could have some things in the past that are like, yeah, I remember my electricity got cut off before. Mm-hmm. But it's like, well, what's the chances that it's going to happen again? And so sometimes you have to play these games with you. Honestly, not sometimes, but you have to play these games with yourself to change that thought process about the future and make it positive. What I tell patients, though, along with medication, is that it doesn't have to be positive, but why don't we just bring it back to neutral? Can we question, is it possible that this may not happen? That's huge. But, one of the things that I want to kind of people to take away from this is don't be afraid of the psychiatrist. Don't be afraid of the therapist. Anxiety is a huge point of suffering that is treatable, and it's something that probably goes way underdiagnosed. It accompanies almost everything. But one of my mentors and my boss, he has this great analogy, and I have a couple too, but he mentions that medications are like a life preserver. You're in a boat. Mm-hmm. You're in a boat floating with whatever you're dealing with. And he throws this medication, not in the boat. The boat capsizes. Now you're in the water, in the ocean. It's got sharks and everything around. So he's like, you can't swim? Boom. Let me toss this at you. Okay. Let me give you this medication that keeps you afloat. Right? The medication keeps you afloat. Mm-hmm. But do you want to stay in the ocean bobbing like that forever? Absolutely not. I know. No. So how do we get you to shore? You have to swim to shore. You have to do the work to get to shore. And I think that's what they forget, is that I can help keep you afloat, but you have to get to shore. The thing I like, more of a little hip-hop-ish, is let's say we're in the car riding, got the tunes, got basses all the way up. Hey, I produced it. Got to have the bass up. And so we're trying to have a conversation. Now imagine it's with yourself, though. Now medications turn down the volume, turn down the bass. Yeah. So you can have that conversation. That's what therapy is. It's the most important piece. But we can't do it if we don't give you a little something. Some people have the music all the way up when they need something. Some people, they ride with it on a nice, reasonable, respectable, but now,
Not you, though.
Not beat. Yeah, I mean, so I'm already through the neighborhood. I know my neighbors hate me. And so, but again, a long answer again, there are things you can do. Grounding, breathing, the cognitive work is what I want people to really focus on, is writing down your thoughts before bed. And you said it perfect. I'm a doctor, but I'm also a patient. I don't do this stuff all the time either. Right. Anxiety hits me too. Write down your thoughts. Get to the gym.
Okay, talk about that piece, because that's and when we talk about strategies for resiliency, whether they're mindfulness, whether they're breathing, whether they're grounding, I like that. I like that grounding piece, because it doesn't require, you can be in a meeting, sitting at a desk, and you're there. And
they don't have to know
yourself. They don't have to know that you're trying to navigate this new space. But talk about the value of, and I'm just, resistance training.
Yes.
You know, because we hear about runner's high. I don't, you know, and I work out. Nobody.
Yeah, I think it's
aware of that. But I work out, and there is a certain elevation that you get during a good workout.
Yeah.
So talk about that piece and any, I guess, biochemical mechanisms around resistance training piece.
Yeah, of course. So I'll say I'm in the gym every morning, whether or not I get sleep or not, whether or not it is my grounding activity. And so that is something that lifting weights, and you could do this with running, but there's a set of progressiveness. You know, I did 5 pounds this day. Can I do 7.5 pounds? I didn't say 50 pounds the next day. 7.5 pounds, small increments. But that's the grounding activity. So the idea of progress, patient progress. I think one of the phrases is aggressive patience. I like this phrase. Yeah, it's not my phrase. I stole it from somebody. But the idea of this, that's the gym. So the resistance activity, moving your body, moving your muscles, getting your blood pumping, working under load, under stress, and allowing your body and your mind to understand that you can handle the stress. You can handle the load. Okay. It is an exercise in applying stress, recovering from the stress. All these are important pieces. Now, I will say the literature as of yet does not specifically say that resistance training is better than sprinting or long distance running when it comes down to what it does in the brain. So the name of the game is this chemical called BDNF. At least this is what we think. This is what we think. Now, we're not BDNF. We're not, slicing people's brains open, and taking these little pieces out. But the idea is BDNF, brain-derived neurotropic factor, I believe.
Okay.
And so the medications that I would give you in a pill, we believe the reason that they work is because they help to increase this BDNF. And it's kind of like Miracle Grow for your neurons. Okay. Keeps that healthy environment.
I want some BDNF.
Yeah, I mean, that's the name of the game. Chase it. I wish. And so the thing is that by increasing this, we believe it helps to make this nice stew that should be able to handle resilience, handle stress, because your body is under just existing gravity is stressful to the body. Right. So it's to help this mental stress. It helps with pruning. I mean, it's a lot of high level things that are going on at all times, and everything has a purpose. But we think BDNF is the reason why a lot of our medications work and why exercise has such a valuable place in mental health. And I'll say the studies have shown that there was a meta-analysis in the British Journal of Sports Medicine, I believe, which, again, we haven't got it on our side yet as far as done the deep dive, but it's such a powerful study that it's New Zealand or Australia has made an argument that providers need to use this exercise as a form of treatment for depression and anxiety as a first-line therapy. That the studies have said that it's 1.5 times better than medication or therapy. Now, again, I'm not saying that this study is, long.
Because you already
please look it up. You look it up.
I'm gonna look at the
thing is, 100%. And the thing is that it's weird that it's in a sports medicine journal and not any psychiatrist.
Well, it's not weird, because when you look at one of the biggest limiters for performance, right? So when I talk to men that are coming in with heart concerns, but they know I train, I give them the 3 Ps of what males as they age should focus on from their training. First part, it should be preventive. At the end of the day, you got to think about how not to get hurt. How to improve your heart health, how to improve your resilience. Preventive. Number 2, it has to be practical, right? Now, unless you're going the route of doing bodybuilding, why do a 500-pound deadlift on 90? You can't move anymore until third. Why do
exactly? I don't understand. Right? I don't understand.
And then thirdly, it has to be performance-based.
Yes. Okay.
And one of the biggest things that you said, whether I get sleep, you wake, you're coming to the gym.
Yes.
Right. But for many people, when stress, anxiety, depression, other things occur, guess what? They don't do. They don't come to the gym, and it's this self-fulfilling prophecy that they feel worse. And so most folks know that if you can find a mechanism or a behavior or a habit, right, that individuals will do over and over again that we know provides multiple benefits, they're going to do it. So for the athlete, even though you might not train in your sport that day, you may train to do something else.
Yes, 100%. Yes.
So that it allows you that ability to still get those feelings.
Yes, 100%.
And this is great. So I'm going to go ahead and tell them about a program we're going to start.
Okay, yeah.
Physical therapy, right? And we talked about it, right?
We talked
about.
Yeah, we did, yeah.
That's how I'm like, No, because we realized, like today we talked about anxiety, touched on the depression. And I'm not going to ask, how many DSM-4 or 5 or 8? I don't even know what DSM.
5TR.
5TR.
Yeah.
How many mental health diagnoses are in there?
You put me on the spot. I couldn't, off the top. Oh yeah, that's what I was saying. When you break it down, when you kind of shred it out, it definitely depression. What we call it is mood disorders.
Okay,
has a definite shred out. And then when you add in, like I said, the post-traumatic stress, we have some shred outs. What we tend to focus on is what we call severe mental illness. So schizophrenia and bipolar disorder. Now, they where we have extra diagnoses is when you add on other components to them.
Right.
And so that's what I'm saying. So it's kind of hard to say off the top of my head, but the book is pretty thick. It's a lot. Yeah.
And there's no way we're going to be able to unpack that in one conversation.
Yeah, absolutely not.
So we've talked about it, and I really want my listeners, your patients, whoever wants to utilize this, we're not diagnosing anything. We are giving you definitions that you can Google and look up.
Please
and
do.
Talking to you about practical strategies on how to improve your mental health.
Yes.
That's all we're trying to do.
Yes.
Right?
Yeah.
This is, and the physical part is, we're going to show you a little gym. Not today. I didn't want to. But we're going to show you.
Yeah.
We're going to show you how to lift properly, how to do certain things in the gym to help you feel more comfortable, because we know the benefits that the gym has. Building resiliency through building muscle, and the neurotropic factor that I'm going to look up when I get home. I can facilitate that. Well, as we come to a close, what are some key takeaways that you want people to get from this?
I would say self-awareness. That's been my biggest thing. I wish I could wear a T-shirt. Self-awareness is key. Okay. Because we have to first know that there's a problem. We have to know when there's not a problem, and that the solution is within us if we are aware, if we can slow down. And this is why, I've been listening. I heard him say he prescribed one of his patients 5 minutes of mindfulness. That's what's so key about mindfulness. It's about taking the time to understand self-awareness is key. And so once you can do that, not what you can, but you got to do it for your life, honestly. Right. There's nothing wrong with getting help. It's actually one of the most courageous things you can do is bare your soul to a complete stranger for the purpose of having a better life for yourself and the ones around you. There's nothing wrong with getting help. The other thing too is when you go get help, remember we talked about a connection. It's possible that therapist or that psychiatrist is not for you. It doesn't mean there's anything wrong with you, and it doesn't mean there's anything wrong with them. It's a connection. This is a huge piece. And so don't give up just because it might not work the first time. I think that without giving a whole list, self-awareness is huge. Get help. It's courageous. It is courageous. It's not weakness. Weakness is keeping that within
And
letting it disrupt everything. Don't let it win. Don't let it win. I'm about to get emotional. Don't let it win. And then the other thing is, when you get help, remember, it's a connection. It's a journey. Don't quit the first time you do it. When I was in the gym, I didn't quit. When you were going, we don't quit. When you were learning to walk, how long do you give a kid to learn to walk? Until they learn to walk.
That's true.
Dude, what parent is gonna say, oh well, let Kenny don't give up. It's time to give up. You cannot escape your own mind, so you cannot give up. It's gonna be there forever. So don't give up. So sorry, I get on my stool, but yeah, self-awareness. Go get help because it's courageous, and then don't give up on the process.
I love it. Yeah, I love it. Thank you, first off, for being open, for being available.
Yeah.
Because that's one of the challenges that I think patients feel is that I can't reach my doctor. I can't connect to my doctor. And this is a mechanism, like I said, this is about fitness, nutrition, and health literacy. But having someone that, heck, I can even reach out to and talk to and help me. Okay, how do I help this patient pass this? Or if I have a challenge or an issue. And so as we close out the month of May, which is Mental Health Awareness Month, I think this was a perfect discussion to have as people are more aware now. Now, did we fix every ill? Did we identify every problem? Did we give you strategies and tools? No. But what we did is we gave you a starting point. A starting point that starts first with you to have a period of self-awareness, where you use that awareness to say, how do I change my situation? And how do I, even though I can't escape my brain, learn how to manage my feelings, right? Then what we decided was, you gotta be courageous. You gotta say to yourself, I gotta do something that I've never done. And that's saying, number one, that something's not right, that there's a problem, it bothers me. And number two, going and get help. Not easy, right? Even, no one wants to say that something is wrong. And number three, finally, give yourself time. Aggressive patience, right?
It does, yeah.
Oxymoronic, right?
It does.
But that approach, or that kind of odd approach, allows us to say, it's going to take time for me to unpack all those things that I had, have a clean slate, and allow someone else to help me reframe the way I pack it. So as you go into your day and go into the rest of your week, I want you to understand and embrace the opportunity that you have to change your life. And as we say here, we want you to be focused, purposeful, but most importantly, we want you to live intentionally forever. Thank you. We truly hope you enjoyed today's episode. If you did, share it with a friend, leave a comment, and certainly join us for our next episode of the About That Life podcast.